The article that I chose for the assignment was called Household Income, Cortisol, and Obesity During Early Childhood, a Prospective Longitudinal Study. And I chose this because I know that obesity is obviously a huge public health issue in the United States that causes many other problems down the line, high blood pressure, diabetes, things like that. And I know that household income can have a big impact on that. And as a parent myself, I obviously am always trying to, be as nutritious as possible with my kids, but there are obviously other factors that impact that, and household income, I think, is one of them. So it's just something that I was curious about. And when I saw the article was also about cortisol levels, which is stress, I thought that that would be really interesting to see how that can have an impact as well. So before reading the article, I obviously knew that, as I said, obesity is very high in the United States, especially in children, and that nutrition is a big factor of that. But I've heard obviously that household income can have a big part of that as well. If people are in poverty, they don't have access to as much nutritious foods, organic foods, things like that. Money for activities, keeping their kids outside because they're working a lot more and things like that. So I knew that that would obviously have a correlation, but I didn't know how stress could impact that, and I was interested to hear about that. So the article obviously relates to this class because it's what we're talking about with healthy diet and nutrition, and obesity, which can lead to other factors that can impact health as children grow up. So the article talked about the study, which followed children at various ages, 12 months, 24 months, 36 months through age 4, families with low income and then income that was increasing. And they looked at their hair follicles to see their cortisol levels, which indicate stress. And they also looked at household income. So they looked at both of those things separately and looked at their body mass index, which indicates obesity. So they did find that there were disparities in socioeconomic, there were disparities in childhood obesity based on socioeconomics, and that had already been proven, but they wanted to see if they could correlate that to stress levels as well. So their findings showed that both poverty and cortisol levels do impact childhood obesity over time, and that the annual rate of change in body mass index was significantly higher in children who remained in very low income households over time, but that the cortisol levels that they tested suggest that even modest increases in annual household income may reduce those stress levels and reduce the burden on children's developing stress systems as well. But they found that those two factors could be independent of each other, and they really couldn't find a direct correlation. So I obviously agree that all of those things are probably true. I'm sure it's very stressful to live in poverty, and that can cause stress for the children as well when they see their parents stressed. And then so again, they couldn't find if it was causation or correlation between those two, or if it was two separate things, at least within the limitations of this study. So I do feel like it's partially like a chicken and the egg situation. Stress can obviously be caused by living in poverty, but it also can be caused by having health issues such as obesity. So is it that the stress causes those things, or that these things cause the stress? And I guess that's part of why they couldn't pinpoint that as well. So that's something that I would be curious about, if there was a way to do a study that could kind of pinpoint more the cause of that and which one causes the other, but I'm not sure, how they could do that. And I would also wonder how parents' health and stress levels could impact the children as well, and how genetics could play a part in that, and parents' health issues, and parents being obese versus not, etc. But I did find the article very interesting overall, and it's something that I would be curious to learn more about.